Hello everyone. Today we'll be discussing about the World Cancer Day. World Cancer Day is observed every year on 4th of February. This World Cancer Day will be observing since 4th of February year 2000, and it was decided after the announcement at World Cancer Summit against the cancer for new millennium. That summit was held at Paris. So, what were the reason to started celebrating the World Cancer Day? So, first one was to raise the awareness about the cancer among the common people. Second one was to encourage the persons about the prevention regarding the cancer, about the early detection, and for the early timely access to the treatment for the cancer. The third reason for observing this World Cancer Day is to decrease the misinformation, to clear the misinformation regarding the cancer among the common people. And the fourth reason for World Cancer Day is to reduce the stigma related to the cancer among the people in society. So, coming to the theme now. So, as we know that for each and every health days, a theme is declared. So, let's see the themes for the World Cancer Day. In 2016, a 3 years campaign was started. 3 years campaign means it was a multiple year campaign. Means that we will be deciding a common theme for consecutive 3 years. For example, for the year 2016 to 2018, the theme was We Can, I Can. From the year 2019 till 2021, the theme was I Am, I Will. And for the year 2022 to 2024, the theme will be Close the Care Gap. It means for year 2023 World Cancer Day, the theme will be the Close the Care Gap. And this multiple year campaign gives us opportunity for more exposure, more time of exposure, more engagement regarding the to raise the global awareness about the cancer, and so that the ultimate impact can be on the higher side. Coming to the impact of observing this World Cancer Day. So, as we know that cancer is preventable and curable. So, this World Cancer Day can be helpful in spreading awareness, so that people can aware that this cancer can be prevented by the preventive measures. There is cure or treatment is possible for the cancer. So, early detection is very important, and timely and proper treatment about the cancer in healthcare facilities possible, and that can be easily accessible. And it was found that as per the WHO, about more than one third of the cancers, means more than 30% of the cancer are preventable, that can be prevented if proper preventive measures can be taken. And about one third of the cancers, means about more than 33% of the cancers can be cured if these cancers are diagnosed at early stage, and the person who is diagnosed with cancer can access the treatment timely. So these are the impacts. So, coming to what is cancer. So, cancer means any abnormal growth of the cells in the body, and it has quality power to invade the other tissues of the body, and this is the reason why the cancer is very dangerous. When we see the most common types of cancer, so it is breast, lung cancer, colon cancer, followed by rectum cancer and prostate cancer. When we see in children, so in children leukemia is very common, lymphoma is very common, and brain tumor. These three cancers are very common in children. Let's see the signs and symptoms related to the cancer. So any person having cancer can have very heavy night sweats. He can feel fatigue. There will be any unexplained bleeding or bruising in the body. There can be any unexplained pain of any part of the body. There will be unexplained weight loss of more than 5% or more than 10%. Any unusual lump or swelling can be present in any part of the body. Any development of new mole or changes in the size or number of moles. There will be any skin changes or any wound or any ulcer which is not healing well, taking time. Person can have any croaky voice or hoarseness in his voice, or any cough which is not healing, which is chronic kind of cough. Any mouth or tongue ulcer which is a chronic type, having for more than 3 weeks. If anybody is coughing and blood is coming out, then we have to look that patient suspecting for the cancer. Any difficulty in swallowing, if person is feeling breathlessness, any difficulty in breathing, if there is any persistent heartburn or gastritis or indigestion in the person, if there are unusual changes in the size, shape or feel of the breast. So we have to screen the lady for the breast cancer. If any person is having persistent bloating, or if he is having appetite loss, so again we need to suspect for the cancer. Any change in bowel habits, like if person is having constipation or loose stools, or increase in frequency of stools. If any blood in the urine or stool, there can be any unexpected vaginal bleeding, that can be after sex, or can be between the periods or after the menopause. If blood is there in urine or stool, so these are the signs and symptoms when we can suspect that person can have cancer. Let's see the risk factor for the cancer. So cancer risk factor for the cancers can be divided into two different kinds. First one is non-modifiable and second one is modifiable. So non-modifiable means there is no way to change the reason behind the cancer, change the risk factor behind the cancer. Like if any person is having any genetics, means any genes more prone for the specific kind of that cancer, so it is very difficult at present to change the genes. If carcinogen have already been introduced in the body, so in that condition we can't change that risk factor. If person is having weak immune system due to various reasons, so these all three reasons are non-modifiable. Coming to the modifiable risk factor, modifiable as the name suggests, it can be modified by the changing the dietary habit, lifestyle, adoption of any specific kind of health activities. So this modifiable risk factor can be alcohol consumption, unhealthy diet consumption, if person is obese or overweight, tobacco consumption, if there is any lack of physical activity, if person is exposed to ionizing radiation, if any kind of infection is there which can cause cancer, like human papilloma virus, hepatitis virus, or person is exposed with any hazard during his work at workplace. So these are the risk factor for the cancers. Coming to the states data regarding the cancer. So there are some facts like it is the second most common cause of death after the cardiovascular disorders. Cardiovascular disorder is the topmost reason for the deaths. About one third of the deaths which are due to the cancer are due to the tobacco consumption or high BMI, person is obese or overweight, alcohol consumption, or he is having lack of physical activity, or unhealthy diet like low fruits and vegetable consumption. As per the WHO, about 9.6 million deaths, it means around 96 lakhs of deaths in the year 2020 were related with the cancer. It means in every 6 deaths, 1 death was related with the cancer. It is found that about 30% of cancers are due to any infection, like it can be due to human papilloma virus infection, or it can be due to the hepatitis virus infection. Let's see the some more facts about the cancer. So as per NICPR, National Institute for Cancer Prevention and Research, a nationwide study was conducted, and it was conducted between 1990 to 2016, and in this study it was found that the number of cancer cases have been doubled from 1990 to 2016. When we see the crude cancer incidence rate, so it was found that it is highest in the state of Kerala and Mizoram in India. In India, approx 13.9 lakhs new cancer patients are diagnosed every year. It means out of 9 people, 1 people is having cancer. So prevalence of cancer is increasing. About the cancer related deaths, so it was found that about 8.5 lakhs of death are directly or indirectly related with the cancer per year. It is found that in men, cancer of oral cavity, stomach and lungs, this comprises of around 25% of cancer related deaths, and in women, cancer of cervix, breast and ovary, this comprises of around 25% of cancer related deaths. Coming to the National Cancer Awareness Day. So as I mentioned that we are observing World Cancer Day on 4th of February. So apart from that, in India we observe every year National Cancer Awareness Day on 7th of November, and this was first announced in September 2014 by our former Indian Health Minister Dr. Harshvardhan, and 7th November date was chosen to coincide with the birth anniversary of Nobel Prize winning scientist Madame Curie, who herself died of cancer due to the exposed by the ionizing radiation, and she is remembered worldwide by her discovery of radium and polonium, and due to her high contribution and fight against the cancer. Coming to the health program related to the cancer in India. So in India, the health program which is related with the cancer, which covers the cancer, is NPCDCS, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular System and Stroke. And we have implemented this program since year 2010. It means almost we have completed 12 years with this program, and This NPCDCS program mainly covers all non-communicable diseases, including cancer. This NPCDCS program, this focus on strengthening of the policies, guidelines related to the non-communicable disease, including cancer. It also focuses on human resource development so that a dedicated manpower can be developed, that can be prepared for better screening, diagnosis and treatment. It also focuses on health promotion for preventing all the non-communicable disease including cancer. It also focuses on early diagnosis of the cancer at the initial stages, followed by proper and timely management of the cancer, and also the referral of the cases, cancer cases, in case required. So let's see the activities which are observed during the World Cancer Day celebration. So health talks by the expert who are expert on the cancer and cancer screening treatment are organized by the government and non-government organization. Play or skits are organized at schools, colleges, for any groups to raise the cancer awareness. Some government hospitals, organizations, medical officers, they organize free checkups and screening camps at their locality. Free consultation by the cancer specialist, oncologist is organized. Panel discussion is also organized so that the doubts, queries related with the cancer can be discussed in between the expert of that field and that in front of the common persons, so that they can also be benefited of that knowledge. Light purple or lavender ribbons, they are used to represent the cancer so that common people can be aware about the cancer. So we have come to the end of this slide. So thanks for this watching this video.